Hello, hello, hello. It's good to see everybody. Hi, happy Monday evening. It's great to be here with you guys and to see you. Let me straighten out my shirt here. Make sure. Okay, I think I'm okay. There we go. Okay, so hey guys, I'm Dr. Jen Caudle. I'm a practicing family physician, on-air health expert, and video creator. You guys know that I do videos every single day on health topics. Many videos are on COVID, but so many other things because COVID cases are increasing. And when I say they are increasing, they are shooting up. Not only that, but we've got the Delta strain that is more highly transmissible and is really helping these cases just shoot right on up, y'all. And we've got a large number of people who are unvaccinated relative to other areas. I'm spending more time talking about COVID lately because it's necessary. And you guys have questions. And this is really important because the goal is to stay safe and to stay healthy. So we're talking about something that has recently come across my mind the last couple of days, and you might be thinking about too, which is this idea of, well, should we start back to wearing masks? That's the question. Should we start back to wearing masks? Shoot, I always forget my laptop. I always start before I'm ready because I get so excited to see you guys. I always start before I'm ready and I don't get my other laptop with me. Okay, so the question is, should we start back to wearing masks, guys? Is that what we should be doing? And I know you guys have thought about it. Why? Because there's been some rumblings about it on the news. We're hearing about Delta variant. COVID cases are increasing. Not only that, but breakthrough cases. By the way, for those of you who have not liked and followed my page, please make sure that you do that so you can get access to COVID videos. Also, check out, for those of you who are on YouTube, as well as my Facebook folks, I did a couple of videos that you might be interested in. A video a few days ago that's basically entitled, if you can still get COVID, why bother getting the vaccine? Which is a question that a lot of you guys have asked. So I explain why we should still get the vaccine, even though COVID breakthrough cases are possible. Please check that out. Also, I just did a video, posted that today on what the long-term side effects of the COVID vaccine are, because a lot of people they're worried about that. They're wondering, what are the long-term side effects? So I literally go through that in a video today. For those of you on YouTube who have not subscribed to my channel, please do. So let's talk about these face masks, because it basically was inevitable as we see COVID cases basically increase. We see Delta variant literally taking hold of the world. We see certain areas of the country that have not even reached a vaccination rate of 40% for their communities. Meanwhile, we've got other states and places that are 70%, et cetera. We know that it's different throughout the country. The big question is, should we start masking up again? And let me be very clear. If you are unvaccinated, you're supposed to be masking up already, and you were supposed to have never stopped masking up. I think one of the questions and the problems that so many of us have is that I am concerned, as I know many of you are, that many people who are unvaccinated are also not masking up, right? That's a big concern that I have always had. And I know that's a big concern that so many of you guys have had too. But for those of us who are vaccinated, the CDC has said and still continues to say, well, we don't need to be masking. But should we? Should we go back to masking up? I've actually been thinking about it. And to be honest with you, my parents live in Tennessee. Tennessee has a relatively low vaccination rate and has COVID cases that are increasing. And my parents, interestingly enough, they are in their early 70s. You guys saw the video of them getting their COVID vaccine. And I talked about the side effects they had after the COVID vaccine. My parents actually never stopped masking up in public. And I'll be honest, in the beginning, I was like, guys, the CDC says we cannot mask up, yada, the data, the evidence, blah, blah, blah. They never stopped. In fact, they're still double masking. When we started talking about double masking back in January, my parents were like, yes, that is us. Yes. And they never stopped. They've been double masking the whole time. And you know what? I kind of have to say, ooh, y'all might have been on to something back then. They're still double masking. And honestly, if they were not masking up going into indoor places, especially because of where they live, if they were not already doing that, I probably, as their daughter, might ask them to start doing that. So the question is, should we be masking up or not for those people who are vaccinated? This does not apply to the unvaccinated, because if you're unvaccinated, get your vaccine. But if you're unvaccinated, you're supposed to be masking up. So I say, to decide and to determine what you should be doing, there's a few things I think that you should keep in mind. By the way, I should also say that how the CDC just recently came out saying that for schools, when back to school starts, kids who are unvaccinated need to wear masks, right? And kids who are vaccinated don't need to, although the CDC did say that it's a layered approach and other things need to be happening in the schools, and schools can kind of make their own decisions based on the region, blah, blah, blah. Well, the American Academy of Pediatrics today came out with 3 snaps and a head roll saying, hey, we actually believe that all kids, American Academy of Pediatrics just today said all kids over 2 should wear masks regardless of vaccination status. What do I think about that? Well, Fauci was put on record today saying that he could understand where they were coming from. And I have to say, I understand where they're coming from too. I mean, the safest thing really is for all kids to be masked up, and the reason why that's the case is because, as many people have said, how do you police masking, or rather, how do you police vaccination status in schools? Schools are not required to have kids show proof of vaccination. What are they going to do? Walk around like as police people? Are you vaccinated? Show me your vaccine card. You're unmasked. Like, that's not going to happen. That can't happen. So you're probably going to have, just like adults have been doing, some kids who are not vaccinated who are still not wearing a mask, and it puts them at risk and it puts other people at risk. The safest way probably is to have everybody mask up, but it definitely is a change. And I know it's probably confusing. Look, it's not what I want. I would like, and I do actually agree with the CDC guidance in that theoretically, if you're vaccinated, you don't have to wear a mask. If you're unvaccinated, you do. But the problem is all the variables, the enforcement of that, also the region of the country that you're in. If you're in an area where there's low numbers of people who are vaccinated, but high rates of vaccination, you might want all your kids, whether vaccinated or not, to be in school with the mask on. So there's a number of variables. But for those of you parents out there, just understand that we're with you, and you'll have to wait to see, I believe, what your school district is going to require, what they're going to say, what you also choose for your family as well. Because even if you are vaccinated, remember, your child can still wear a mask, okay? That's not being precluded. But anyway, I just throw that out as an example of mask wearing, right? We were ditching the masks. Now we're kind of pulling them back out, right? Also, remember a few weeks ago, the World Health Organization was the first one to say that even vaccinated people in certain parts of the world need to be wearing masks. We were like, what? No. I was like, well, that ain't what the CDC said. And you know what? They make decisions for the whole world. So, of course, they're thinking about all the countries that have not received vaccines yet, all the countries that have, high rates of infection, but low rates of vaccines and stuff like that. So I understood it. But the truth of the matter is, it's funny. Maybe they were ahead of the game for the U.S. before we even knew it. This is the thing. You go into stores, you go into restaurants, and most people are not vaccinated. But the question is, how many of those, you go into stores and restaurants and you see most people are not wearing masks, right? The question is, how many of those people are not vaccinated? And I did a video on this. I did a video on how many people will basically lie about their vaccination status in order to go unmasked. I put that out there. And you guys, many of you have commented about that. If you haven't seen that video, take a look, because it's really asking this question, which is really what many of you all who are vaccinated were worried about from the beginning. You said, wait a minute, I don't know if I want to go without a mask, you said. This is what you said on my videos. You said, the vaccinated people, I don't know if I want to go without a mask because I'm afraid a lot of other people who are actually not vaccinated, unlike myself, will go without a mask. Now, let me be clear, though. The idea of should we go back to wearing masks if you're vaccinated is less about vaccinated people getting COVID than it is people who are unvaccinated getting COVID. Let me try to explain myself. It still stands and it still holds up that if you are vaccinated, you are still very largely protected from COVID. Yes, you are. And it still stands according to the CDC, and they stand behind this, that if you are vaccinated, you don't need a mask, okay? We do know that there are breakthrough cases that can happen, right? And I know that breakthrough cases are scary and they're tough, but remember, I just did a video on this explaining why it shouldn't worry you if breakthrough cases happen, which they will if you're vaccinated, and also why you should still get the vaccine even though breakthrough cases happen. So some people are saying, oh, well, you can still get COVID if you get the vaccine, so why get the vaccine? No. No, you still get it. Check out that video. I talk about it. But the thing about it is, if someone who's vaccinated were to get COVID, The likelihood is that we'll get a stuffy nose or might have like a little like something. Likelihood is that we're not going to be hospitalized or die. The idea about wearing masks in public, yes, would help those people who are vaccinated, right? It would give you another layer of protection, but it's really probably more for those who are unvaccinated to try to minimize any potential further spread that may happen. You know, this is the thing, guys, and I'm not trying to like point fingers and say, I told you so. Like, I'm not trying to do that. But let's just be clear that what's driving the pandemic at this point is the people who are unvaccinated. And I know those of you who are unvaccinated are not going to want to hear this. You're going to be bad. You're going to be, you're going to write me. You probably are right now. I haven't looked at the comments. Let me look. And you're going to be mad. You're going to be angry. And you're going to say, you can't tell me what to do with my body. And this is experimental. It's not. This is untested. It's not. We don't know the long-term effects. We do. Like, you're going to say all that stuff. I get it, right? But the truth of the matter is none of that changes the fact that this pandemic is largely being driven by those who are unvaccinated. And the risk of making you even madder and more upset, and I'm not trying to do that. Oh, here's the comments. I'm looking for the comments. I'll also say that one of the reasons why we're having to consider mask wearing again, there are places that are going back to mandatory mask wearing for everyone. So for those of you who are unvaccinated, hey, you're not exempt from this. It's not just vaccinated people who are considering wearing masks. There are states and regions and schools and parts of the country that are putting mandatory mask mandates back in for everyone. That's you too, unvaccinated folks. Hate to say it, but kind of feel like y'all unvaccinated people are the reason why we in this mess. You're going to yell at me. Come yell at me. And I also kind of feel like the unvaccinated folks are the reason why I'm even worried about and thinking about wearing my mask again. And that's why some areas of the country are saying, wear your mask. You know, I'm not a doctor who points fingers and tries to make people feel bad. You guys know me. You know me really well. You've seen my videos. I try to say everything as much as I can in a compassionate way, because I don't believe in like pointing fingers and being like, and, you know, blame and all this stuff. I don't believe in that. But, you know, there's a part of me that really feels like, dude, unvaccinated folks, you're primarily the reason why cases are up, hospitalizations are up, deaths are rising, that places are considering putting back mask mandates, that we're probably going to have to go back to where we were in some ways. And I'm sorry. I didn't plan on saying that because I've been thinking that. And I was like, you can't say that, Jen, because that sounds really mean. That's not really nice. You know, I never want to alienate people in my videos and with the work that I do here. This is a place for everyone. It really, really is. But I guess I just had to say it. I guess I just had to say it. You're fucking shit up. Okay, I'll wait for the comments to come in now. Okay. Anyway, so but let me flip this around just a little bit. Okay, after I've said all of that, let me also say that we want to protect the unvaccinated. Don't get me wrong. I want you to be vaccinated. You should be vaccinated. Don't give me all that bull about what we don't know and what you don't think, and because you're reading all these crazy blogs with people who know nothing about medicine and science, and you don't like people telling you what to do, and you don't want people controlling your body, and you don't like big government, and I'm a sheep and a sheeple and all the words that you say. Blah. But the truth of the matter is, bottom line, whatever it is you believe, I don't want you getting sick and dying from COVID. I don't want you getting COVID. I'm a doctor at the end of the day. Am I disappointed people aren't getting vaccinated? Sure. Do I feel, just as so many other experts, that unvaccinated people are driving this pandemic? Sure. By the way, some of you are going to say, but Dr. Jen, I can't get vaccinated. You know, it's not fair. No. You guys know I'm not talking about the people who can't get vaccinated. I did say unvaccinated. That's the word I've been using, but we know, and it's understood, just so I'm clear, I'm not talking about people who that cannot be vaccinated. Those who have allergies or underlying medical conditions, etc. We're not talking about that. Oh, and by the way, let me throw that in too. Because the unvaccinated, right, while those who are unvaccinated are standing on whatever principle or moral that they've decided they have, they're also putting other people at risk, not just themselves, right? And not even just the people around them, right? So if you're unvaccinated, you're really super likely to get COVID because of Delta and all this stuff. And you could probably give it to people around you, but that's not even what I'm talking about. I'm talking about people that really, really have no choice. Little babies. What about people who are cancer patients or HIV patients or patients with weakened immune systems because of the medications they have to take for their rheumatoid arthritis or their lupus? They can't help but be at an immunological disadvantage when it comes to an immune response to the vaccine or the ability to fight off things. They can't help it. It's unfair for them. It's unfair for them, too. So once again, I'm not talking about people who can't get the vaccine. Okay, there's no need to yell at me for that. Yell at me about other things. But what I am talking about is people who can get the vaccine and choose not to. This is a really good thought that I just lost my train of thought. Sometimes in my mind, like I get a thought and then I have like these other branches off of it and then I get lost in the branch. I think that's just what happened. Anyway, so what I'm trying to say is masks. Yeah. Oh gosh, it was going to be so good, y'all. Wonder how good it really was going to be. Yeah, I'll think of it maybe not. So anyway, I guess my point being is, Melissa, you said healthcare workers are fed up. Yeah, I know. That's actually really the truth. And that's the thing too, is I'm also worried about my healthcare colleagues, right? You know, I'm in the office and I'm literally, and I think I'm going to do a video about this, by the way, because flu season's coming back around, right? And because COVID cases are coming up, I was literally talking to my medical director in the office. I was kind of in a panic. I was like, oh my God, we have to start testing for COVID the way we were before. Oh my God. And she's like, what is wrong with you? I was like, it's the numbers. She's like, deep breaths. I was like, but I'm already thinking, like, you come in with a sniffle, I'm gonna be like, you better get COVID tested because COVID's running rampant. We got Delta, we got all this stuff. Maybe what I was going to say was about people who are vaccinated. Oh, I don't know. And yes, Lynn, you said those who can't vaccinate rely on others to get vaccinated. That's what herd immunity is. Yeah, we do know that from other vaccines. So I guess, okay. So back to the point, the topic of this live, which I'm going to get back to. Okay, I digress. That's what I was talking about. Back to y'all unvaccinated. Now, this is going to be nice. You're going to want to hear this. I'm a doctor. I'm going to go back on my original plan. I'm a doctor. I don't want you all, and when I say you all, I'm talking about unvaccinated in this situation. I don't want you to get COVID. You know that, right? Like, I really just want to level set here. You know that we're not enemies. And based on the comments I get from those of you who are unvaccinated and don't plan to get the vaccine, you talk to me and to other followers who have gotten vaccines as though we're enemies. That's where you're wrong. We're not on different teams. We're all on Team Humanity. We're all on Team World Team, go Team, go. We're all on like team, we're humans, we'd like to stay alive, and we want each other to stay alive. For those of you who are watching this video who are unvaccinated, or even those who are vaccinated, yes, I used some expletives this evening, but let me make it very, very clear. I don't want anyone getting COVID. I think one of the reasons why I get so worked up is because we know that over 99% of deaths from COVID happen in those who are unvaccinated. And the CDC has basically called this deaths from COVID as something preventable. I am a family doctor, y'all. You know how I feel about preventive medicine? That is my thing. It's all about prevention. If we had a vaccine to prevent breast cancer, how much would that change the world? We had a vaccine to prevent colon cancer, a vaccine to prevent HIV/AIDS, a vaccine to prevent, think about it. We have a vaccine to prevent COVID, which arguably is doing just as much damage as many other conditions. Heart disease, we learn. I mean, COVID surpassed, heart disease in terms of morbidity, mortality, et cetera. Don't quote me on that, but it's like the idea, right? Think about it. I know that any one of you, especially those who are unvaccinated, would jump for joy if we had a vaccine against breast cancer, colon cancer, this cancer, anything, you name it, lupus, rheumatoid arthritis. And yet we have a vaccine for COVID. And so many people are like, nah, I'm going to sit this one out. When we know how deadly COVID is. And getting COVID doesn't require a genetic predisposition. Breast cancer mostly happens in women. It doesn't require a gender. COVID will infect anybody. And it's highly transmissible, these strains that we have now. What I'm trying to say is this. Back to my point. For those of you who are unvaccinated, we're on the same team. I'm not against you. I don't love you or care about you any less because I get upset, frustrated, and angry. Or that I get disappointed at some of the things people believe that are blatantly false. Or that I get frustrated at some of the people on the news or people in the media or in politics that spew lies. We're on the same team. No one wants anyone to die. No one wants anyone hospitalized or on a ventilator from this, or for anything for that matter. No one wants anyone to transmit this to other people. So what I'm asking is that we all start looking at this issue, and right now it's like the vaccinated versus the unvaccinated. It is. But it shouldn't be. We're not on different teams. We're all on the same team. We're all in the same spot. We're all in this together. And just think, if there was a vaccine, a brand new vaccine, brand new, brand spanking new, that could prevent breast cancer, you telling me you wouldn't run out to get it? Because I certainly would. I remember the vaccine that came out to prevent cervical cancer, the HPV vaccine. I remember I was a medical resident when it came out. Let's talk about new vaccines. Let's talk about them. It was, I was a resident. Was it, 2005, 2006? Or I don't remember what year it was. It had just kind of come out just around then. I didn't qualify for the HPV vaccine at that time because I was older than the guidelines were at the time for that vaccine. But I was like, what? You mean I can get me a vaccine that will keep me from getting HPV, which is sexually transmitted? So it will prevent me from getting an STD and cervical cancer? I was like, yo. You know what I did? Brand new vaccine. Because I couldn't get my insurance to pay for it because I did not meet the criteria. I paid for that joker cash. I remember I paid something like over $200 per HPV vaccine. There's 3 of them. It's a 3-course series. I paid cash. I was a medical resident. I didn't have $600+, but I did to prevent an STD and cancer. Oh, yes. And I did it with a brand new vaccine. That's what I'm trying to say. Vaccine comes out tomorrow that prevents breast cancer. You gonna tell me, nobody can tell me what to do, my body. I'm just saying. Just saying. We're on the same team. I don't want you all unvaccinated folks to get sick or die. I don't want you to experience what you don't have to. You see all those articles that are out now about parents or children or people that are in the hospital ventilated that are now speaking out saying, I wish I had done things differently. I just would encourage you guys to pay attention to these articles. And I would also say that I'm sure there are some people that would like to change their stance on this, like to go from like the unvaccinated camp to the vaccinated camp. I hate calling them camps, but it feels like that, right? I know there are some people that probably want to do that, but might be afraid to. There's a lot of peer pressure sometimes with this about what we believe. I've had patients tell me that they have gotten shamed by their family. They've gotten yelled at, shunned. There's really a lot of division with this. And I could see how in some situations there may be a tendency to want to just stay the course, to stay with the unvaccinated camp just because you've been there, and the pressure of staying with any side, right? It's not just that. It's, there's other peer pressures out in the world. But you may be afraid to go really the way you want. I had a patient that told me she was afraid to get the vaccine primarily because she was afraid of what her husband would say because he was so anti-vaccine. She wanted it. Her issue was she was afraid to go against what was sort of status quo in her household and within her family. What I want to tell any of you who are in that situation is, I'm not going to tell you it's going to be easy because I know it may be very hard. But this is where you have to say, okay, this COVID vaccine actually is a life or death situation. It actually is. And you know what? Give it a shot. Step out on a limb. Talk to your husband, talk to your wife. Try. Get the vaccine. do the right thing. I don't know. So, should people be worried about getting back COVID from a person who's not vaccinated? Yes. Yeah. I mean, that's the problem, right? Because those who are unvaccinated have the highest risk of getting COVID, especially with Delta. And yes, even though those of us who are vaccinated are largely protected, wearing masks would give us an extra layer of protection. But it's also, it would help protect those who are unvaccinated, having them wear masks too. That's the idea. So, Lisa, should I take my blood pressure medications on the day that I get the vaccine? I wouldn't do much different unless your doctor tells you to. Double check with your doctor. Concentration camp, that's what this feels like. I'm not sure what that means. And I don't know why we need Holocaust references for anything to do with the vaccine or in any way. Pretty protective about the Holocaust and all of the evils that have happened in this world. So let's not go around using language and evoking imagery and events and misappropriating them. And just be very clear about that. Don't do that here. And take that somewhere else. Don't do that here. So a lot of people are chiming in as usual, but that's why I do these lives, because I care and I love you guys. And we are in this together, even if it doesn't feel like it for some people. We are. We are. So, yeah. I don't know. Lots of things to think. I'm so glad you guys are here. Like, I so love you guys. And so many of you guys have sent stars. You're like the sweetest things ever. Thank you so much. You like warm my heart. By the way, for those of you who send stars, I'll respond to you personally. If you have a question, you can ask me the question that you have, and I'll respond to you. You know, it's I see some of you guys going back and forth. Joy, you said you got ridiculed for getting the vaccine. I think that's going to happen with a lot of people. And yes, the decision to get vaccinated is a personal one, but I hope that the possibility of death would seem personal enough that would make you get the vaccine. And Terry, you're jumping on, like, you know, evoking the Holocaust. Yeah, let me be very clear. I mean, I can tolerate a lot. And a lot of people come on my page and they say just the meanest things, like really mean things. Okay. And for the most part, I do not ban people unless they are spamming with comments like those, you know, find my mentor, Mr. Blake, if you want to make $1,000 a month, like stupid stuff like that. If you say racist stuff, every now and then I have someone referring to my blackness, to me being black, being a black female. Racist stuff will get you banned. Holocaust evoking, which I'm going to go and find that person that's talking about that, and they will be banned. That is not going to happen here. You are not going to do that here. You can take that somewhere else. Don't you for 1 minute think that that's, no. And I'll go back through the comments and I'll find you and you'll be banned. I let people say what they need to say for the most part, but there is a limit. So, yeah. Pinky, you're still trying to make up your mind to take it or not. I appreciate your honesty. Pinky, tell me what your concern is. Maybe we can help. Oh, by the way, guys, check out the pinned comment. There is a group called I Got the COVID Vaccine. It's on Facebook. So for those of you who are on YouTube, join the group on Facebook. I Got the COVID Vaccine. After this live, I will go and I will accept all of you guys. You can hear from other people who've gotten the vaccine, hear from people especially who've been afraid to get the vaccine. I wanted that group to be a safe place for people to talk about their concerns, to get motivation, to get encouragement, to get cheered on. It's a safe place. Of course, if people are like, you know, acting crazy there, I ban them as well. But that's a safe place to talk about, hey, I got the vaccine. You post a picture. We're like, yes, hello. And literally, that's what the goal is. So make sure you join that group. I got the COVID vaccine t-shirts. I know some of you are like, why is a doctor selling t-shirts? Well, because I wanted to find a way to give back. And I donated a portion of the proceeds to the Red Cross. And I hope that this was a way that you guys and all of us could get excited. It's a way of showing pride. And I wear these shirts all the time. So I want, let's see here. I'm just looking for that person who saying things they shouldn't be saying. But anyway, so that's why I sell t-shirts, is because it's my personal way of giving back. And I love the colors and I think they're comfy. And I like showing my pride for the COVID vaccine. And I hope you do too. Remember, we are going to get through this together. Sometimes I say things that are harsh or that are stern. I don't know that I have any other, I don't know that I know how else to do it. I often have to tell my patients when I get stern with them, it's because I get scared. I can do a couple things when I'm afraid. I either cry, like tears for me don't always indicate sadness. Oftentimes and usually it indicates fear. Also, when I'm anxious, I cry. And then when I get scared, sometimes I get really stern, like with patients. And I'll be like, so why didn't you take your blood pressure? Why didn't you call me for a refill? Why? You know my number. You know my number. Why didn't you call? You could have sent a portal message. And they'll be like, Dr. Caudle, I'm sorry. I'm sorry. I'm like, I'm sorry. I'm not mad at you. I'm just concerned because your blood pressure is 220 over 120. Like, you know, right? So when I get stern, it's not that I'm not with you and I don't love you. It's sometimes that I'm scared and I'm a little worried right now because COVID cases are increasing. So know that I love you. I love every single one of you, vaccinated and unvaccinated. And especially for those who are unvaccinated, I worry about you. I do. And I don't want you to get COVID because it's unnecessary. Think about the disability, the loss of work, the possibility of giving it to family and friends, the long COVID potential symptoms afterwards that many people get. Is it worth it? I don't think it is. All right. Should I stop preaching? Maybe I should, huh? I love you guys. You're amazing. Thank you for letting me sort of drone on. I guess I always have to get things off my chest during these lives, don't I? I always think, oh, just have a normal live, Jen. Just be normal. I literally have this pep talk with myself before I go on. I'm like, we're going to be normal today. We're not going to cuss. We're not going to swear. We're not going to get mad. We're not going to snap our fingers. We're not going to do this. And then I'm like, and then let me tell you what else. And what you need to do, that's what happens. And I don't even plan it. So love y'all. How do you encourage a family member to get the vaccine? Maybe I'll do a video on that. Thank you for the stars, everybody. I love you immensely, more than you know. We're going to get through this. Hang in there. Hang with me. Join my group. I got the COVID vaccine. Thank you for the stars. Like and follow my page. And I'll see you tomorrow, okay? Mwah. Bye, YouTube. Love you.